New research released this morning suggests diabetes drugs like Mounjaro and Ozempic, which some people also use to lose weight, may also help patients suffering from addiction to drugs and alcohol. I want to bring in Dr. Celene Gounder for more on this. She's a CBS News contributor and editor-at-large for public health at KFF Health News. Celene, good to see you. So we were talking about this earlier. Explain how this study, or what this study says about these medications and how it might potentially affect people who are battling addiction.
So this was a study looking at electronic health records from patients at over 130 health systems across the country over almost 10 years. So it's quite a large data set. And what they found is that in people who had opioid use disorder, the rate of opioid overdoses went down by 40% among those taking these weight loss medications. And for people who had alcohol use disorder, the rate of alcohol intoxication went down by 50%. And these are opioid overdoses, alcohol intoxication that brought people to the attention of healthcare providers. They ended up in the ER, the hospital. So these are very serious events that are being prevented, it would seem, by these medications.
So in the future, then, could patients be prescribed these drugs for addiction, even if they don't have diabetes or are obese? And would that be just maybe a pleasant byfunction of this, which would be that you would lose some weight?
It's certainly possible. We still haven't seen randomized clinical trials on this, which is the gold standard. It's what you would need, or what the companies would need to submit to the FDA for an expanded indication, which also then paves the way perhaps for insurance coverage. Right now, insurance coverage remains very very difficult to get, even for people who do have obesity, one of the core indications. But it is certainly possible that in the future we will see broader use for a number of medical conditions.
So this is what I think is so interesting, Celene, is that oftentimes medications that are on the market or developed to treat one kind of symptom end up being useful for something else. And that's happened with a slew of medications over the last couple of years. Why is that? Why help our audience understand when a pharmaceutical company is developing a drug, it's, say, targeting one particular ailment, that they discover later on that it actually works to help with other things? Well,
so these drugs, they're called GLP-1 drugs. They mimic the hormone that's made naturally by the gut, the GLP-1 hormone. But in making it for a medication, they made it so that it would last a lot longer. So it lasts a full week. You only have to inject yourself once a week. That lasts much, much longer than what you make naturally yourself. And as a result, we're also seeing more penetration into the brain. And so seeing these effects that we have not seen with the natural hormone itself. And what we think is that these drugs are having an impact on the dopamine reward pathway in the brain. And if you think about, addiction, it's really about reward and an abnormal reward system, whether it's addiction to food or addiction to alcohol or opioids. And so there's probably a lot of overlap in the neurology, neuroscience of this.
Fascinating. Dr. Celene Gounder, always great to have you, my friend. Thank you.